People don't have that access. And if our systems are all based on the assumption that people can get around by car, then people who don't are excluded. We know that adults who are active have a 20 to 30% reduced risk of premature death. Now, that has got to be, again, something that we have really got to focus on in terms of how it integrates with this transport issue. And walking and cycling are superb forms of physical activity for the reason that they can be built into people's daily lives. Because again, what we know is everybody's terribly busy, and if you ask people to go out and do physical activity as an extra thing to do, most people find that extremely difficult to do. But if in fact we can get people more geared towards active travel, it's something they can build into their lives, which actually is a win-win. Just a few economic costs which I think probably will be quite striking to people, really. An estimate of the costs of hospital and ambulance costs for injury accidents that are related to roads, 560 million nationally. Now, by any calculation, that's a huge cost to Cumbria. The cost of physical inactivity, there was a survey done last year or the year before. The British Heart Foundation led this piece of work, and they looked at the costs to the NHS of physical activity in terms of how it played out in terms of diabetes, coronary heart disease, for example. And the cost to Cumbria was calculated at 8.2 billion across the country. Then there are the issues about particulate emissions and sulphur dioxide and so forth. And again, you can see a big figure there across Great Britain. But then looking at the bottom one, which is the cost of actually doing something about it, the estimates around the cost of implementing 20-mile-an-hour zones in Kingston upon Hull was thought to be £4 million, but the benefits were seen as 40 million. Now again, I think there's an awful lot of cost-benefit stuff in here, and I think when we're looking at a transport plan for Cumbria, we need to be looking at what are the benefits to which we aspire, and how much would it cost to make some shifts towards those, but what actually could also be the financial benefits for that. Physical activity is vital to good health, and I'm sure everybody here is aware of that, and it's been referred to earlier as well. We know a lot about the reduced risks of coronary heart disease and stroke and diabetes, but perhaps people are less aware of the benefits in terms of mental well-being. There are actually concrete improvements in mental well-being in people who raise their levels of physical activity. So this applies both to people who have mild mental health problems, but it applies to all of us. We all feel better when we are more active, and that is actually a measured response. So if we're looking for a Cumbria where people have higher levels of well-being across the piece, we need to be looking to support our population to be more active, and active transport is a really positive way of doing that. Because what we know is that actually most of our population need to do much more in the way of physical activity. Only 1 in 3 adults meets the minimum required level of physical activity. Now, in the Chief Medical Officer's report last year, his last report at the end of his tenure of the post, he majored on the issue of active travel as, if you like, the miracle cure that he thought we needed to build into the way we do our public life in Britain. And basically he said if this was a wonder drug, we would want to have it. And it's actually a wonder drug that is available to all of us. This is just a quick summary slide of something that Lynn has referred to, which is really this issue of the balance between how people make their journeys. Now we know that levels of walking and cycling have declined enormously as car dependence has grown and as cars have become relatively cheaper. But this provides us with a win-win opportunity, and if we look at the graph on the right, we can see how in every other country in Europe, walking and cycling is much more of a daily part of people's ways of making journeys. So it can be done differently, and we could do it differently. This next slide has got far too much information on it for you to sort of take in just now. But there's just the top 3 points I just want to draw your attention to, and if you can use a microscope on your notes, you'll be able to have a look at the rest of it later. The key issue here, this is from the National Institute for Clinical Excellence, guidelines around evidence-based approaches to improving the physical environment to increase physical activity. So this is the first time we've actually had a major review of all the evidence that was available about how we could help and encourage people to be more physically active. And the first point is around strategies, policies and plans, which I think is what we're doing today, and how much it matters that new developments always prioritise the need for people to be physically active as a routine part of their daily life, so that local services should be easily accessible by foot and by bike. So that's the first one. The second is about pedestrians and cyclists getting highest priority when developing or maintaining streets and roads. And the third is about planning and providing comprehensive networks of routes for walking and cycling, making it convenient, safe and attractive for people to get to work, homes, schools and other public facilities. Now I know that one is a big challenge for us in Cumbria because often people have to move greater distances, but it's also about changing how we think. One of my colleagues who works at Penrith, where the PCT has its headquarters, he comes from Carlisle, and almost every day that he comes to the office, he comes on the train with a folding bike and he cycles from the station to the hospital. Now, I think a lot of people would look at that and think, right, well, that's a bit of a challenge. But he does it every day. And I think in 5 years' time, there'll be a lot more of us who'll be doing that kind of mix and match way of getting from A to B. But our job, I guess, as part of the infrastructure of Cumbria, is to make that easier for people. Sorry? Did you want to say something?
I said if there's room on the train for bicycles.
Well, these are exactly the kind of problems, surely, that we have to solve. So I've just headlined here 4 of the best evidence-based things that we need to do to reduce the harmful impact of transport on health and to actually take the opportunities that developing transport offers us to improve health. So the first is the one about improving air quality, and this is really a serious issue. So this is about traffic management, it's about thinking about how all this works together when we're looking at urban planning. Using technological solutions, I think that's a kind of slightly a counsel of despair, but then of course there's the issue of switching to alternative vehicle technologies. But the active travel issue, as you can tell, is the one that I'm really passionate about. We also have to work with people to actually change our own and our community's view of what's possible and how we might do things differently. Yesterday, in my mailbox, I received a mailing from Sustrans about some programmes that they have been doing along with the Ramblers and a number of other third sector organisations, actually working with communities to look at producing solutions from the community to these sort of problems. And the way in which they've actually managed to change the distribution of journeys that those communities have made, how they are actually making 2 to 5 mile journeys differently, I think that's a real sign of success, and I think there are some things there that we can build on, and I know this is the kind of stuff that Lynn wants to develop.
I think the key messages from the spending review are, first of all, more latitude for local communities and local authorities to set their own priorities. That's good, but less money to do it with. Maybe not quite so good. Nationally, the Department for Transport's budget has gone down. Its capital budget's gone down by 11%. Its revenue or resource budget has gone down by 21%. So there's less money coming from the centre to the counties and the regions than there used to be. And DFT is talking about making tough choices about investment priorities, for example, for the strategic road network. What that actually means is, if you happened, maybe unlikely after our 3 presentations this morning, to think that a major road scheme was the answer to transport problems in Cumbria, DFT at the moment is saying, no, actually, we're not even considering any new bids for new road schemes, apart from the ones that we've already got in the pipeline. They're just not open for new suggestions at all at the moment. They've set up a new local sustainable